to me. And you really can't do one without the other unless you start at ground zero, which is that access to nutrition and proper nutrition, good foods, and just the whole idea that, you don't have to be hungry. There is some help that's available to you out there.
I'm Missy Cody. I'm the interim chair of the Department of Nutrition at Georgia State University. I was retired for 4 years and then went back as interim chair for just this 1 year, and I'm on the board for Senior Connections. In my private life, I do quite a bit of advocacy work for the Academy of Nutrition and Dietetics. And of course, hunger is one of the areas that we focus on. I think the film does a good job of showing us what the problem is. The problem is not just numbers, it's people, it's individuals who have the variety of problems that Maureen talked about and that we saw. And I think one of the hard pieces of this is that when you hear about all of the programs that are out there, it's easy to think that we have solved this problem. But each of those programs reaches a very small part of the potential population that needs to be reached. And I think that's one of the challenges that we all have. I think that one of the problems that I've seen over a long time, when I was growing up, you could tell who was poor. You could walk down the street and you could see people that you knew were poor. That's not quite so true anymore. You can look at people that you see in the store, that you go to church with, that your neighbors, and they may own their own home, but they may have a real cash flow problem. That problem may not just be theirs, it may be their families. They may have people in their families that have problems that they're trying to help. So when you look at the programs that we have that are out there, access is an issue. The size of the programs is an issue because even if we were able to help everyone possible with the programs we have, we would still reach fewer than a third of the individuals who have demonstrated need. So I think it's important as we look at that to begin looking not just at what the problem is, but what our solutions are. You know, what can organizations do? What can individuals do? And I think that's the real challenge. It's not knowing there's a problem. It's looking to see what your role is in helping to solve that problem.
And that's a perfect segue, as I was sitting there listening, just thinking that Debra Furtado, I know, I think all of you, the CEO of Senior Connections, I'm so glad Matt Piper from Open Hand has joined us, our peer, and we partner. And I think the key thing as I was listening and watching this was that thinking about Meals on Wheels, we had talked about that, and there was not as much talk about that, but how getting access. I think one of the issues we find with SNAP benefits will be seniors that can't get to the store. That's the issue, is transportation. And I was watching this thinking, how can we together, especially the nonprofit community, partner to Tiffany, who runs our customer service and in-home care. We have folks that are receiving in-home care who probably are eligible for SNAP. And how do we get them access to that? That's the hard part, because when I heard about the program in Georgia, it's not easy to sign up. So how can we make it easier? That's one way. But then the other part is they cannot get out of their home. Like the reality is, as I listened to the folks that were talking, is that they just can't go to the store. They don't go to the store, like they don't go to Kroger or Publix or like we do. And the people that are using SNAP benefits are usually folks that have a car somehow, are able to take MARTA. How do we get that information to them? And I loved hearing, I'm hoping that at our SPARK events, at least in DeKalb County, that we did have that information. But I'm glad to see folks like Vernon and other folks from the senior center here, because we can get access to the senior centers, but the concern is those individuals that are at home, and truly, and home could be anything. Home could be in a deliver meals on Saturday, and if you have a HUD facility, like a Decatur Christian Towers or, places where you go and you deliver meals and they truly do not have access. They cannot get out of their homes. So that's just something I was thinking that is a concern, is that when you say SNAP to them, one is that they're living in a HUD facility. People are probably working with them and helping them. It's probably those that just cannot drive.
Well, I don't think it's just that. My grandmother used to tell me that she could no longer stand and stir. You reach a point where even if people bring you groceries, making use of those groceries is a problem. You may not be able to see well enough to work equipment or to look at instructions on a product. You may not be able to stand long enough to cook some of the products. You may have arthritis and not be able to hold the implements that you need to cook with. And there are other considerations that go with that. If you've lost some of your sense of smell or taste, you may have problems preparing foods that you really want to eat. It may be very difficult for you. Now, I was very lucky. My grandmother loved to cook. She was the one that I learned to cook from. And she lived to be right at 98 and was self-sufficient up until the last 6 months of her life. But that standing and stirring was really a problem. And she stayed with it longer than most of her friends did. Most of her friends had problems much earlier than she did. And she said, the only thing they eat is coffee and saltines and cereal, because they can pour the cereal in a bowl and pour milk on it. You don't have to do anything much to be able to do that. Coffee was what got everybody started in the morning. And unless someone, a friend or a relative, brought them something else, that's pretty much what they lived with. And we're not talking about people who had economic concerns. There are concerns that go beyond the economic concerns.
And I'd like to add to that, it isn't just the physical nature of being able to stand and stir. In many cases, it's the emotional problems or
Depression.
My own father suffered from depression. And so in my business, I knew to call for a meal route. Well, there was no meal route. And so he was on a waiting list. And I tell you this because sometimes even access is thwarted. In my home, I had plenty of food. I could leave all the meals in the world for him, but he was never going to serve himself that meal. And really needed that social interaction. We had to come up with different solutions of our own. But I tell you that, and add to that he did get a call that finally there was a route available for him. He had already passed. So, shame on us. If you're looking for solutions, where are our voices? It isn't just about a meal route. It is, why are we talking in this day and age about reducing food stamp benefits with a broad brush stereotypical picture painted of welfare beneficiaries? Shame on us.
Amen.
Shame on us.
No, I agree. And I have to tell you, give credit to, we were talking earlier about a woman that, Carl knows, a woman that, Chris, we did her yard work. So this is a woman who fits kind of AARP senior. She's not eligible for services because of her age. She's young, and she needs some help. And so through grants that we have, we were able to provide her with meals. The other day when I emailed her, emailing, and I said, how are you doing? And she said, doing okay. I love the food, which is great. Like we always love dietitians, especially love hearing that. She said, but I'm worried because your staff told me that the grant would end the end of December. And I said, no. We're going to make sure she gets meals. And so Tiffany and I, we worked it out. And she said, because my SNAP benefits have been cut. Now, she is someone who's able to go and buy groceries. She said that meal means so much. And I was thinking, too, that, Missy, the other part of it is the chronic diseases. I think when you were saying that, stand and stir, is that there's also the point that, there are so many different therapeutic meals that are provided. So that's the other part that I think we have to look at is you have meals for people who are diabetic, who are low sodium. I mean, I don't know, back there in the kitchen Monday, I mean, there's everything from, you know, mechanical soft. I mean, a lot of these things that people cannot, you know, you have people with dental issues because Medicare doesn't provide for dental, so they can't eat and they need that mechanical soft meal. So I do think that's the other part of it, is they don't have access, and then going to the store is just not going to work for them. So they really need 3 meals a day.
Yeah.
You want to go first?
No, I'm looking for audience participation.
We at OSA have spent the last 2 years trying to increase the take rate, if you want to say, in the area of SNAP, and have been thwarted at every turn. We have a senior hunger prevention program that Senior Connections has worked with us to deal with, and I did the prelude to see if I could get to the back end. One of the issues, the primary issues, is after we've identified individuals that could possibly apply for, get them down to DFACs, and doing all of that sort of stuff that requires us to do that is absolutely horrendous. So, am I to understand that this phone number that you gave me for AARP is now a direct, different way of getting individuals to be able to apply for this?
Yes.
So I can actually remove myself from all of the bureaucratic stuff that way and just go to the streamline this way? Is that what you're telling me?
That's exactly what I'm telling you.
You know, it's really good to be able to count those numbers, and that's a big part of advocacy, because when you can show that there is a need, then you have a much better opportunity to have programs funded. And Maureen said shame on us for SNAP. I'm also going to say shame on us for the Older Americans Act.
Okay.
Not,
Yeah.
I mean, really, when you begin to look at what our safety net is supposed to do, it is supposed to provide benefits for people so that they remain a part of our community. And the Older Americans Act, SNAP, and other similar programs do that, and do it very well when they are in place and when people know how to get access.
I think you bring up an important point, because as times are leaner, everybody's looking for a piece of that pie. Not to say
Well,
that.
You know, our enlightened self-interest is that if we can provide the food and the in-home care that people need, and truly minimal help with their housing, then we're going to be saving money, because it costs a lot more money to put someone in a nursing home than it takes to help them stay in the community. And I know we're talking mostly about older folks now, but older folks lend stability to a community. They are at home. They are people that, when things are going on in the neighborhood, if you keep them connected, we'll be able to help everyone with knowing what's going on. They are the grandparents that help grandchildren. So,
You know, just to kind of fill in one of the stories talking about safety nets, Nate, who you saw in the film, who opened it up, his story is he was a basketball star, and he was at a college party, and somebody started shooting, and he spent 6 weeks in a coma, and his life was never the same. And he wasn't even in a position to know where to go get help, because what was left of Nate after he got out of the hospital wasn't the same person that he started with, and that's his life. And he spent a lot of time just trying to find something. Welfare mooch? Hardly, you know. And you probably saw, you know, the film did drift a little bit into some of my personal polemics toward the end, especially the part where everybody in the community is valuable. You know, as far as I'm concerned, nobody makes it alone. You know, and the people who say they do I've always asked them, did you spend the morning mining the minerals to go into your computer?
So, you know, and when we talk about in tough times, everybody's looking for a piece of that pie. If you think about it, you know, it's the people programs that are being impacted the most. When most infuriating to me is that first week of the government shutdown, when within 48 hours, people didn't have to stand in line in the airports anymore because they got that funding released. And my instinct, and Matt and Debra, maybe it's something we can work on together, was to get the seniors with their empty trays in that same queue line at the airport. Just all around the room with the sign like, and how did it sequestration or the shutdown affect me?
Powerful, yeah.
I mean, you know, we can't, I can't believe that, you know, it is the people who are being impacted the most, and yet at the same time, we know we have to build a louder voice around the sequestration, build a louder voice around the Farm Bill, which is now, you know, coming up, it'll be coming up after the first of the year. They're the same people, and we can be pretty visible, even those of us who color our hair. So we have the numbers. If we can't show up, we can at least be visible in many other ways.
Yeah, and I think that the concern is that even with what's happening now with the budget that Congress, the Senate will probably approve today or tomorrow, is it sequestration, that it won't be as bad. But I think as I talked to Carl and I think, you know, Sheila, I know with Jessica Cobb, is that the problem is we're serving, I'm sure we're serving the same numbers. They're not increasing it. We have people on a waiting list. We always say, we just look at, I'm sure Fulton and DeKalb are the same. So we serve almost with senior centers and home delivered meals, you know, funding allows for maybe, I don't know, 800 a day, probably a little more with grants. But there are like 10,000 people out there, just in DeKalb County alone, that live below the federal poverty level, who are seniors, who we don't know. So they need something. And I think it goes back to what y'all were saying. I think we should be really upset about that. I do appreciate, I think, the advocacy. And that's something I think, Maureen, that we need to really focus on, is to be there. I know our state, we're trying to get some things done with the Council on Aging, the $10 million over 5 years, the $50 million ask for home and community-based services. We go in, we meet with state reps and the committee chairs, and I've just been part of that group. And I find the elected officials are wonderful to us. They'll say, well, we gave $15 million for charter schools, we can do $10 million for seniors, but $10 million isn't even enough. It's just over 20,000 people that we know of on the waiting list in our state for home and community-based, including in-home care and meals, and I think those are the two main programs.
Do we have any questions? Any comments?
I have a comment, and so Senator Isaacson, good friend to all of the agencies that are serving seniors, and somebody that Deb and I have spent time with, and he's always reminding me to, let's say, son, don't forget the math equation, the cost-benefit analysis, and the fact that the services that we're providing, this is a smart investment. If we're able to keep people out of institutionalized care, if we can keep people in their homes where they can live with dignity, we can save taxpayers thousands of dollars while also providing a better quality of life. And it's that cost-benefit analysis that helps legislators understand that why these cuts are counterproductive. They're so the wrong decision. It's a short-term solution to a long-term problem, and that's something I think that I look forward to working with Senior Connection, Meals on Wheels Atlanta, Community Food Bank, and helping people understand that math equation of it costs about $4,000 a day to hospitalize someone. We can feed someone with healthy meals for about $20 a day. It's not, it's not rocket science, right? But it is profound, and it is.
It's about a $50,000 a year savings a year per person for someone to receive home and community-based service, including in-home care. So that's, you start multiplying that really versus 70,000 for the.
So with the 1-800 number, getting back to kind of where you were, Carl, because we in home care, we have over 60 CNAs that are going out to senior homes. They have seniors, but we also find the family members, the aunts and the uncles and all these other people in the home. if someone is able, if one of our CNAs are able to call the number, and even if they haven't gone to the website, they can access the website and fill out information via telephone for a client, is that okay?
Yes, yeah, and I would call into that number, and, because that's, they do several things, and one of the things they do, if somebody doesn't have a computer, they fill out the form. And it may not have been clear from the movie, but AARP is doing that under contract with the state, with Lucy Smith, you know, and it's a concerted effort throughout the state. And I don't want to go into this too deeply, but if you're not 50 or plus and you call in, they'll still help you.
Yeah.
I just kind of wanted to add, because it's been something that's been brought home to me in the last couple of weeks, is that, yeah, we can't get people off of waiting lists, and there's some people that we can't even start to serve. But even some of the Meals on Wheels clients, especially that we're serving now, we're having to cut back, because we have people that we're getting Ensure or Glucerna, because we can give them one meal a day and sometimes some extra packs, but they were also getting to Ensure, and now we can't do that. Some of our volunteers are actually going out and buying them for them and taking them to them, because we have it when we have the funds, but they count on that extra nutrition. And like he said, if they're not getting that and they start losing weight or their health goes down, then these are the people that are in the hospital or in the emergency room first.
You talk about this cost-benefit analysis, and I know that everybody's got to be pretty well smart to understand it. So if they don't understand it, there's going to be another issue. And so if there happens to be another issue and you're addressing the cost-benefit analysis, then you're not addressing the root. And if the root happens to be, I don't have any poor people in my neighborhood, and I'm not going to take my money and give that to you so that you can give it to poor people. If we've lost this sense about we're all one little ball and we're all on this thing, then addressing the cost-benefit analysis only helps those that think that they're in that particular community. And that's only a thought.
Right.
But if they're smart and they don't get that, there's got to be something else. I don't know what something else is. Okay, I'm not saying I know what it is, but as an example, it might be that we're affluent, we have it, we whatever. I don't have any poor people in my neighborhood. I'm going to keep my money in my space, and I don't care what your equation comes out.
You are so right, Carla, and if I could just add that, and I really do think you're right, and I get frustrated when I'm in the room with folks who think that way, and yet they're there. I try to remember that everybody pays taxes, and that that sometimes can be a message to folks who may not have the level of empathy that I would want them to have, but when you talk about their pocketbook and how it's impacted, because ultimately if we're not providing the right services to people, it raises taxes, and it's obvious that our healthcare system is really crippled as it is. And so I so appreciate your observation, because you're absolutely right. And there are people out there that, well, this is not happening in my neighborhood. Those people should have made better life decisions.
And it will come back to them anyway, right? It's going to come back to them anyway,
Right.
in the long run.
Yes, sir.
But we don't oftentimes see the long run.
Yeah.
Yeah, and I think the thing we could do is, to your point, is that I think we have to be careful. We don't just focus just on the outcomes and become very, try to be real scientific about this and say, and very clinical, because there is a part is that, right, the empathy, the passion. One of the things we can do what we've done, is getting Senator Isaacson, and he has delivered meals, here, getting him and everyone else, and every board member and every elected official, because, we have in DeKalb County districts 1 and 2. District 1 is right here, and is Elaine Boyer. District 2, Jeff Rader's district. Those are the districts that actually have we deliver the most meals. It's not in Lithonia. It's not in. So it's interesting. So we have to get ready to do both things. It's that perception. It's not in my backyard. And when I've said that, and I need to say it more at commission meetings, hey, it's Dunwoody, Chamblee, Decatur, parts of the city of Atlanta, where, at least in DeKalb County, where most of the seniors are, we deliver most of the meals. But fewest sites that we have for meal delivery is in Lithonia. So and I'm sure Fulton is probably very similar.
Oh, very much so. Nobody thinks that there's any need in North Fulton, as an example.
Right,
My
right.
goodness, there's
And
need
there's-
all over
yeah.
the place.
Yeah.
I read a statistic
Right,
that.
yeah, nobody in Sandy Springs is poor.
Nobody in
Yeah.
Vance either.
Right.
Not so.
Yeah, maybe, I was thinking other questions, but I know I would like Maureen to talk about what's coming up with advocacy, because that could be
Sure.
really good.
Sure. Well, before I do that, I do want to applaud AARP for doing this, because we do know it's very difficult to get through the administrative part of signing up. It's easy eligibility-wise, but there is some administrative work to that. So having a volunteer force to help seniors do this with all of your partners that you're gathering to help, I know the Council on Aging has also been helpful, is important. And it's especially important when they talk about making cuts to SNAP in the Farm Bill, because if they reduce that benefit so low that it's, you know, you're jumping through all these hoops to get this little benefit, then you're really going to chill people's appetite. I don't mean to be using all
Yeah.
this.
I love it, Maureen. We're going to write these down.
No pun intended. But advocacy-wise, yes, it's critical this year more than ever. I hope that you'll, stay involved. There is going to be this big ask for $50 million, $10 million a year for 5 years. We know pretty much that people are going to look at us like we're crazy, but guess what we have the advantage of it being? We have the advantage of this being an election year and the opportunity to say we're taking names. The campaigning begins in earnest as soon as the session closes. So we'd like to put you down as a champion. Read between the lines if you're not.
Yeah,
So,
right. Only if you're interested in being reelected.
yeah, so, sometimes it takes a multi-year approach. But it takes that, you've heard me say this so many times, it takes us being audible, visible, and on message. And if you're not, and somebody else uses this saying all the time, if you're not at the table, you're on the menu. And so that's how these cuts happen. So I am really getting carried away here, but I swear this was not planned. But in earnest, this is going to start immediately when the session opens, because they intend to be out before even mid-March. And the reason for that is that the people running for re-election cannot campaign while they're in the session, yet their opponents can. And so they want to get out as soon as possible. They're pre-filing all the bills. They're going to hit the ground running. There's not going to be too much discussion about anything. So it's important that we start from day one. January 30th is the rally. We've had tremendous luck in having 300 to 400 people show up, even in the rain. And I say that because I am proud of that effort, but at the same time, I want to point out that I'm right down the street, my office is right down the street, and on other days like Disability Day or Motorcycle Day, whatever day you want to name it, there's thousands. They're all the way down to my office. And so we need to really start beefing up our attendance. If it's not the senior that can attend and the caregivers are stuck at home, they can get their relatives, get their friends, get their students, get everybody to join hands to show up at the rally this year. Some of you may have been at the advocacy training that we did, and we also said that this may be the last year that they're visible on the street, because they're looking at a place to put rallies in the future, which could even be indoors. And so let's get the biggest bang for our buck this year. If all of you can walk away from here and say, I'll bring a bus, I'll bring my neighborhood.
And this is for the entire state, we try to get it right, this is everyone,
Absolutely across
so.
the state, so.
It is well covered by media.
I was gonna say South
Absolutely.
Georgia, North Georgia, so.
And it doesn't matter, they don't have to be gray on the day of the rally. I mean, if people show up, younger and of all abilities, then we have a more profound message that people are watching.
Did you have something you wanted to say?
Well, the film, I think, does a good job of getting the number across, which is probably the reason for the film. Getting the AARP number so that people can apply. Another problem with seniors that a lot of them have too much pride to apply. So I think that's something that maybe future films might address in some way. That's basically it. And there was a problem with the SNAP program that I've noticed that in some neighborhoods in Atlanta, there aren't stores, grocery stores, that supply good food. And so I was going downtown to friends that I would take, senior friends that I would take up to the DeKalb Farmers Market to purchase good food at low prices. And they didn't have that. They had a Kroger that had horrible produce. And that's what they had.
And you bring up an excellent point, because not only that, even if it was great produce, how much more expensive is the produce versus the junk food that they can get? There's another excellent documentary, The Weight of the Nation, where they point out that access to food for people with very low incomes in the bodegas in New York, can get a 99-cent, or spend $3.99 and feed the whole family for breakfast with cupcakes and chips and things that fill their bellies, do nothing to for nutrition.
And in rural Georgia, this is also a problem, that they have to go long distances to get to a grocery store.
Right. And the senior farmers market is also part of the SNAP benefits.
It was something, Deborah just struck me with a bat. The senior centers
Today.
that we today,
Yeah.
the senior centers in DeKalb County are actually located in low-income areas. However, the swath for those that are aging in place, 65, 75, and 85 and older, is this swath that goes out from Tucker and works its way all the way through to Atlanta, right through District 1 and District 2. And then when you apply what they said was any adjustment in what they thought to be their income or inflation or any of that, you now then have that shift to where the food was delivered to those low-income areas, to this high demand of requirements for assistance in this swath that we've never had before.
Yeah.
One of the things I have found, and this is totally anecdotal, is the more well off you are, the quicker you are to ask for help. They don't have, they don't have any problem whatsoever. Pride, well, maybe. It's a robust sense of entitlement. But not always, I will tell you, because I was just talking to my mother, who lives in a suburb of New Orleans, Marietta, and she owns her own home, and it's a very nice home. And she said, Edward, I'm eligible for food stamps. And I said, really? And she said, but I'm not going to do that. and I'm thinking, I got 30 seconds. Yeah, I'll see her in a couple of weeks. I'm not carrying this discussion today. And I'm not sure I'll carry it when I see her. She'll listen to me to a point.
That's right.
And who knows what her thinking is.
I think if people realize that they've been paying taxes, as you say, and that they have prepaid for some of these benefits,